Board of Franklin County Commissioners meeting for Wednesday, August 12th, 2026, starting with roll call.
Commissioner Stottlemyre?
Present.
Commissioner Waymire?
Present.
Chair Metter?
Present.
Vice Chair Harris?
Present.
Commissioner Dickinson?
Present.
We'll stand for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We will stay standing.
Nathan Mudd from Ottawa Community Church. Thank you for this opportunity to pray. And happy start of school. And some of our kids get to wait another week in this county. And want to read just a verse from Psalm 16. I bless the Lord who gives me counsel. And in the night also my heart instructs me. Lord, we look to you for counsel, for wisdom, for guidance. You are the one who knows all things and who orchestrates such beautiful ways here in our county and across our state and nation and world. And so we begin with a time of praise to use this word to bless you, Lord. Bless you, Lord. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen. Thank you. You may be seated. All right. Moving on, correspondence. We have the 2026 Advent Health Mid-Year Sales Tax Update. Sean Perry, or maybe the whole group of you.
Go ahead and get started and then hand it off to Sean. But there's just a couple updates that I always enjoy giving when we get a chance to be here. And the first is just a thank you to the county, to the partnership of Advent Health. As we looked over this last year, we've been able to increase access. We've had more people coming through the ERs, number of admits in our family birthplace. We're anticipating finishing the year at just about the same number of births as the year that we unfortunately had to pause that service. So we're very excited about that. Additionally, we've seen a number of service lines grow that we've been able to add since Advent Health was here. Chemotherapy over the last 5 years has grown 60%, where we're now outfitting a fourth room to care for the citizens in the community that are suffering with cancer as we care for them as well. So first and foremost, thank you. I think that we're not the same hospital and we wouldn't have the same services that we would have today without the partnership and without the county leaning in to make sure that we're making the right investments there. Two things I wanted to share that are exciting news. Every different industry has different areas where they can win awards or recognition for doing a good job. And in healthcare, clinical care and patient safety is the foremost of why we're in this business. And there's a national group called Leapfrog that in essence grades hospitals across the United States. There's over 3,000 hospitals that earn a grade every year. About 900 receive an A grade, which is the highest grade that you can have for patient safety. In this last quarter, 8 hospitals in the entire state of Kansas were recognized as an A hospital, and Advent Health Ottawa was one of them. So we are so proud not only to have access to care for the citizens, but to have the level of care and patient safety that we do here in Ottawa is something that we're proud of, and we hope that the community and county is proud of that as well. Finally, we want to make sure that we're always someplace that not only has accessible care, but that can help explain things that are difficult when it comes to billing and to care that's received. And we've added a patient financial navigator position so that if you're looking to call a number for a question on the bill, you can do that. If you're looking to chat online, you can do that. But if you want to come into the hospital and sit down with somebody face-to-face, during business hours, Monday through Friday, we have someone on site that's able to sit down and go through questions and help understand any billing concerns that you have. So we're trying to, in essence, make sure that we're investing in all the right places and really leaning in to make sure that we're providing exceptional care and making it easy for our team members and our community members to find that care. So I'll hand it off to Sean, who can go through some of the details. But again, just thank you for the investment that you've made and for leaning in this partnership.
All right, thank you.
Yeah, good morning. Appreciate the opportunity to come speak with you all today. As we look at sales tax revenue, the 3 categories I'd like to remind everyone of that, where those dollars can be spent, is capital, operations, and charity care. First, I kind of want to, let's see. Right? That would be helpful. There we go. This is our charity care utilization trend over the last 5 years. The dark blue represents the amount of sales tax revenue allocated towards charity care. And the green is the rest of that bucket, and the numbers on the top is the total charity care utilization spend over those 5 years. Through June, we're at just under 1.4 million and anticipate being at just under 2.8 million to finish out the year. That's a significant increase from where we finished in 2025, but all that's not unexpected. With reimbursement and coverage changes, as well as Brendan alluded to, we've had some significant growth of utilization of our hospital. Year over year, our admissions are up 5%, ER registrations are up about 6.5%, and our non-ED physician visits are up over 10%. So with that growth, we expect the need for financial assistance to continue to grow. So again, it's a large jump, but it wasn't unexpected. As we look at our sales tax revenue we've received through June, we're just under 1.5 million. We are about $54,000 behind where anticipated being through June from a budget standpoint. But some of the areas that I would like to highlight here, the $92,000 spent on repairs. We've had some repairs in our kitchen, our hot water mixing valve, boiler, our OR floor. One of the OR floors need to be replaced. So we've had some detail or some repairs detailed out that we've had to tackle this year. I also want to highlight the significant dollars spent for a labor and delivery program. Through June, we've delivered 46 babies. As of yesterday, that number is now up to 62 year to date and 72 since we opened the program back in September this last year. We're projecting to land around 120 births for this year, and I just want to take the opportunity to thank you all and Franklin County for the support, because that's 72 babies that wouldn't be able to be born here without the support of the sales tax revenue. And then lastly, I'd like to highlight the canopy renovation. This project in total is going to be about $400,000. We've had some disruptions, so I appreciate everyone bearing with us through this period. We're using the old ED entrance, which is our ortho clinic, as our main entrance to the campus currently while the construction's underway. We're partnering with Lloyd Builders and other local vendors to help complete that project. It's anticipated to be done here in the next 1 to 2 months. It's really going to be a new face to the experience that you have at our hospital when you come through those first doors. So here's a picture of what it used to look like. There wasn't anything that actually highlighted that this was the main entrance of the hospital. So we would have patients that would go to the back of the ED thinking that was the main entrance and kind of get lost around the campus. Here is a renovation of what it will look like once it is done. We will actually have a sign that will be able to be lit up at night that'll say main entrance. If you've been over there recently, the steel is actually up. They're working on welding it currently. And it is going to be a big facelift to the front entrance of the hospital. So again, none of this would be possible without the support of you all and Franklin County. So just want to say thank you. And that is what I have today. I'm happy to answer any questions.
I think it looks nice. I think that's it.
Well, thank you very much.
Yes, thank you.
How close does the 120 babies come to covering your operating costs?
We'll need to get up towards the 180 to 200
That's
mark
about break even.
before it really
Has to be
breaks even.
subsidized,
Yeah.
yeah.
Yep.
Makes sense. Glad we have the service.
When we look at the service area that we have, Burlington closed their program last June. So when you look at the entire service area that's grown to the south, there's between 400 and 500 births a year. So we do think
You
that
think it's there to
I
get?
think when we paused the program, we were around 128.
Yeah.
So I think that even being close to that this first year feels good, but I think that there's a lot of growth and need that we have, not only within the county, but the counties around us as well.
Do you have an idea what percentage are out of county?
So we're working on pulling the data. The sample size is still pretty small. So if we have one that comes from out, it kind of skews the numbers a little bit. So as the data set gets a little bit bigger, we'll be able to take a deep dive to see, hey, where's the new areas that we're reaching.
I mean, I can't imagine those are all Franklin County babies. So, I mean, that just shows you definitely have to be reaching out outside of the county.
When we began doing ultrasounds, in anticipation of this coming back, the OB ultrasounds, there was about 200 ultrasounds we did in the first 6 months, and 60% of those were from other counties. So we're still working on the birth numbers, but at least on the OB ultrasound is a good predictor. There was about 60% that were coming from surrounding counties.
Yeah, cool.
How many people staff that? How many jobs, I guess, how many people did you hire?
On the FTE side, I think it's about 14 on the, at least for our labor and delivery floor. There's the physicians in the clinics, but there's quite a few.
Well, we need babies, so.
We do.
I think that's fabulous. But any other questions for him?
Thank you all
All
again.
right, thanks for
Thank you, guys.
coming. All right, moving on. Public comment. Do we have public comment?
Norman Wilkie.
Oh, do I need to read?
Norman Wilkie, 3970, 3790 Pawnee Road, Ottawa, Kansas. I'll tell you what, those people that was involved in making this sure made it good for me. I appreciate it so much. They did a good job. I'm here to get some, Gordon, I'm here to get some understanding of how business is done in Franklin County. It is far from being run by you folks. When job is not done professionally, these people need to be helped or find another home. A prime example is 3553 Oregon Road. The people there are very busy, so they have asked me to talk on their behalf. Time back, a solution was offered on how to fix that problem. I suggest that this commission visit 3550 Oregon Road. Evidently, your people don't see the problem and probably need to have an engineer to solve that problem then or something. The people living at 3553 bought dust control. There are now deep holes in the road where the dust scroll was put. The water comes off of Oregon Road and goes down their driveway and onto their lawn with the ditch in their drive. There are books that teach how to build and maintain roads. When I was in the 110th Engineers, the roads we made never had water standing in the road like Franklin County does after a rain. In about 1965, the township turned the road over to the county. The county engineer at that time had the ambition to make roads to each of the cities in Franklin County. These roads are still excellent in design. A super thanks to Bob Lister and his engineering skills in 1965. Thank you.
Thank you. All right, moving on. Consent agenda. We are today just consider to approve the Franklin County Commission meeting minutes for August 5th, 2026, and the budget meeting minutes from August 5th, 2026.
Motion to approve.
All right, it's been moved and seconded.
Commissioner Stottlemyre?
Yes.
Commissioner Waymire?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes.
Chair Metter?
Yes. All right, moving on to items of business. Consider for approval the renewal of Dr. Robert Nichols's County Medical Consultant and Health Officer Agreement for an additional 4-year term. Brenda.
Good morning, Commissioners. All right. Dr. Nichols has been providing services to Franklin County as the medical consultant and health officer for the past 4 years. We are requesting that you consider to approve Dr. Nichols' medical consultant and health officer agreement for an additional 4-year term. You do have the agreement in front of you, and it is the exact same agreement that we've had for the past 4 years with the extended date. Are there any questions?
Anybody? Everybody?
Make a motion to approve renewing Dr. Nichols' agreement for medical consultant and health officer agreement with the county.
Second.
All right.
Commissioner Waymire?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Stottlemyre?
Yes.
Chair Metter?
Yes.
Thank you.
All right, thank you. Thank you. All right, moving on, discuss and consider for approval the purchase of a 2026 McQueen CCL 166 Type 3 demonstration ambulance built on a Ford F-450 chassis for the total purchase price of $277,133. Christie.
Yeah, good morning. So as you can see, McQueen is Pinnacle. They
got bought?
McQueen bought them. However, the same people are still running the business, so that's fabulous. It pains me to even be here. Medic One is 8 years old, and it has just been a beast in the system. You can see it's got over 226,000 miles on it, but maintenance costs are becoming outrageous on it to keep it in service. And with that many miles, at some point in time, it's going to break down and it's not going to be worth fixing anymore. So I was able to get 4 bids. My recommendation would be going with the McQueen model. It does give us a bigger chassis. We have noticed a little bit of increase in maintenance costs with the 350 chassis. So there wasn't huge difference in cost for the 350 to 450. So I think we would definitely make that up in maintenance costs. And I'm here to answer any questions that you would have about it, the purchase.
Sounds like this one's ready to go, ready to be picked up.
We have it about a 5-week turnaround. There's some modifications they need to do, and then they need to put the new branding on it, and then we'll be ready to go. But out of the 3 of them, you can see one of them was 22 months, or 2 of them were 22 months out. Another one was probably looking at 90 days out, and that was for their demo model. But McQueen is saying in about 5 weeks, this one will be ready to go.
That's a lot better. Sometimes, yeah, waiting that long.
Right.
Is this the 450 have less maintenance just because it's tougher? I mean, or heavier built? I just didn't
So
think-
our division chief, Jason Hudson, was nice enough to put together a little fact sheet about the difference between it. And what we have is the rear axle and gearing. With the 450, it uses a heavier rear axle assembly. And it's paired with steeper gear ratios to move heavier loads and to stop more easily. Also, the suspension, it offers stiffer multi-leaf rear springs designed to carry a more continuous heavy load without sagging, and where that 350 has a little bit lighter of the leaf springs. And then the brakes and steering, the 450 uses hydro-boosted power brakes rather than vacuum assist, so you get more power out of the brakes as well. So, thank you, Jason.
Yes, that answered it very well. Anybody have any other questions for?
We do have the funds available, right?
Yes, I did check. I spoke with Derek, and then I did speak with Janet, and we did verify that those funds were available. Yes, sir.
People need to know that.
Yes, sir.
People need to know that we do prepare for that
Correct.
to happen. It wasn't, it's something that just didn't jump on you. You need to prepare for it every year.
Yes, sir. Thank you.
All right, any other questions for? Is there a motion?
Motion to approve the purchase?
Second.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Waymire?
Yes.
Chair Metter?
Yes. All right, thank you. That moves us on to staff reports. Anything else?
Yeah, thanks, Sabrina. Got a call from David Reeves yesterday. As the 5 of you know, he is affiliated with the Power of the Past Tractor Show. He would have liked to have been here this morning, couldn't make it. He requested that I ask that the county commissioners waive the dump fees for the show. So if you all are willing to do that, then I would pass that back along to them.
Motion to approve
Yeah,
the request.
I guess, Does anybody want to make a
Yeah.
second?
Need a vote since it's within your range?
Oh, he made a motion, so you can
Yeah.
second it.
We get a second.
All right. It's been
Commissioner Dickinson?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Raymeyer?
Yes.
Commissioner Harris?
Yes.
Chair Matter?
Yes.
Couple of other things. Now that we are through our budget season, as the five of you know, that's a grind every year. My focus is starting to shift to other projects now. First, and I'm starting to have discussions with Nathan Boyd, my planning director, and Deanne Farrell, my assistant, about comp plan. As you know, that's something that's been discussed through the years. My intention is to make sure from a staff standpoint, we're on the same page regarding what we feel the recommended path would be. And then from there, I would like to bring that, and we're talking just a path, like what would the five of you like to see? So and that could be anything from updating what we currently have with pertinent revisions to tackle the things that we commonly see, or that could be a complete rewrite of the document. But I think Nathan's been in the seat long enough. I would like to start having those discussions with him. And then yet in 2026, we'll be in front of you guys looking more for your feedback on a direction. And the hope would be that 2027, we start that process. So other priority, our current auditor, 2025 is going to be his last audit for us. And so I intend to start researching replacements. Of course, that is the decision of the five of you, and I will bring that in front of the five of you. But I would like to, if possible, get somebody in here this fall. May not be possible, but to start learning our operation so that they can hit the ground running in January of 27 and get us an audit and, spring, potentially early summer. So want you all to know that I'm going to put appreciable focus on that. And Canvas after this, as the five of you know, and I think that's all I've got.
All right, moving on. Paul, anything? Brenda, do you have anything else to add to today? No. Sheriff, anything for us? All right, Christie, anybody else? Jeff?
Good morning, Commission. Just real briefly, we have got the laydown machine that we'd rented up and going again. So we are in the process of getting the chip seal areas completed. That should happen this week. Then we will be on Rock Creek Road, fixing those locations as well on the stretch that we are not going to be chip sealing this year. What we anticipate doing this year through those rolling hills for safety reasons is closing those roads down for a mile at a time and keeping the traffic away and detouring it around while we do that. So we appreciate the public's patience while we get through that process, but that should happen sometime in the next week, and I'll have it posted online. Our folks are, as you know, this is the busy season for us, and it's extremely hot, and I want to thank them for all the hard work that they're doing right now, because it's that asphalt machine, it's no joke to be behind it right now. But we appreciate everybody's patience as we get through this, and we'll move on to the next things.
Jeff, between all of the asphalt work we're doing now and prep for chip seal, and then the prep work we're going to be doing for Thane Bush on those two structures, is it fair to say this is about as busy a fall as we've had in years?
Ever that I've seen, yes. In the history of public works in the last 30 years with the bridge works that we're doing and the projects that we have going, we are probably as busy as we've ever been. Or are anticipating that in the next few weeks.
When do they, out at the recycling center, do you have any?
Say that again,
The
Ian?
The recycling center? They haven't started on that yet, have they?
The lot.
The lot, yeah.
No, they have not
You
done
you have
that.
any idea what kind of a time frame that's going to be?
They were waiting on, the last time I spoke with Peg and with Jed, they were waiting on the actual drainage, the guttering
all
system
the stuff
that
that
they
they
had,
put in
and
there.
that was what,
Okay.
that was their holdup. But I do
I'm
know that's
excited.
also, I do know that's on the agenda as well.
All right, cool.
All right. Janet?
Just the canvas immediately following, so we'll be in the courtroom upstairs at the historic courthouse.
All right. Commissioners, do you have anything, Dawn?
Yeah, the guys were out putting the traffic signs out this morning on Rock Creek Road when I came through. So that's a good sign. I was going to ask him when we were going. Now I answered my own question with the guys right this morning putting the signs out, and I really hadn't had anybody say anything about it, but I know we've been waiting a while to get to this point. So appreciate it. That's all I got.
All right. Last Friday, I went to Southern Stars Chamber Coffee, and learning about gas lines is actually very interesting and how they compress it. And so interesting coffee, and they may have a great breakfast when you come. So bacon, eggs, sausage, pancakes. So if you leave hungry, it's your own fault. But that's all.
I have nothing to add.
Had the budget meeting last Wednesday. Always, really seriously, it's probably the most important thing that we do. And the fact that we can keep it revenue neutral is awesome. The fact that there wasn't a whole bunch of people in here there was a whole bunch of people in here, but it was employees, and that was nice to see also. So that's all I got.
All right. Is there a motion for adjournment?
Second.
All right. All in favor, say aye.
Aye.
Meeting adjourned.